Wellness is a really interesting framework because it could be a misdirection, just like any diagnosis. What's the purpose of our health is the place I go to, right? What do I want to, health or wellness as a means? And there's a movement in holistic care, in what's called whole health, to talk about the markers of being congruent with what your values are and what you want out of life. Right? And what's beautiful in this moment and what's arising in this moment is a literature that says if I live by identifying meaning and purpose, there's great literature that says we reduce mortality for people who live according to their values and have meaning and purpose in their life. There's an incredible 85-year-old study out of Harvard which identifies the quality of our relationships, which the physiologic mechanism is not being alone, not being isolated, connecting to people through the struggles of life. And that this is a longevity promoter and a wellness promoter in terms of heart disease and cancer. So if we take the idea that wellness kind of means something, and each individual can say what it means. Earlier in my life, wellness was fitness and vitality. Now it's not going around like a zombie because I've overdone it and taking 5 days to recover from physical exertion so that I can work out less but more frequently. But if I really think about what I want out of my health, what I want is a fullness in life. What I want is an ongoing engagement. Right? And that leads to your other question. How does something like resilience or the factors that let us manage, right? So I guess I'll take a step back for a second. The misnomer of wellness, right, and what you and I have identified as obstacles, it's the obstacles that we want. It's the obstacles that give us feedback about where we are. It's the obstacles that refine the next step, right? So if I'm working with somebody and they say, I want to do 2 hours a day of exercise, I'm like, what's the minimum that you want to do that you could do every day without interruption, and see what it takes to just do something every day, 5 or 10 minutes. And then when you learn the obstacles of going from 10 to 15 minutes, right, you actually have worked through something which we'll call wellness, which is adjustment, accommodation, learning, and growth. It's not that wellness isn't a useful term, it's more useful from broad strokes. So if a population, right, if we're looking at American mortality and saying, oh my God, we're like a non-industrialized nation compared to other nations, where we have markers and we know that infant mortality and maternal mortality, and across every decade, right, Americans do less well than our comparable nations. This has something to do with, though we have the markers, we know what our hemoglobin A1C should be, we know what our lipids should be, we know what our VMO2 max should be. It's only a general guidepost. Now, when I'm with you, or when you're talking with your loved ones and trying to figure out what you're going to do around health, you take the broad marker of wellness and you begin to translate it, right? In my life, how does that express itself, right? Beyond that, what would I do if I had a level of wellness or vitality or however I'm defining health? So all of it is useful, and the question is, how do you parse it for you? For me, it's pretty easy right now. It'd be great not to get COVID. But more than that, I tell this joke, which is for 25 years I got a flu shot, not for me, but to not be a vector of transmission. But why did I get a flu shot? Because I had another option, right? What was my other option? I had to wear a mask. I was not willing to wear a mask. So, right, so now, not only am I willing to wear a mask, I'm willing to be the only one wearing a mask. Whether it's Barbie or at the grocery store, I'm going to wear a mask. Right. And I'm going to do it with the idea being that if I do one thing to not get COVID, that's okay. In the world of many different perspectives and points of view, wellness specifically, for people who identify strongly, right, I'm not going to eat gluten because it might be a problem for me, right? Or I'm going to gear myself to an LDL cholesterol of 70, or as low as I can get it. How do we look at that and work with it? And this is the place where, again, population-based information is useful and maybe help somebody individualize so that one, they're either going to follow a guideline, or two, they're going to differentiate, right? So if I look at general recommendations in a population, I know that the risk accrued from a given marker, so if your hemoglobin A1C is pre-diabetic, right, and the continuum 5.6, 5.7, up to 6.2 or 3, non-diabetic, but, right, so for every 1,000 people, 1 or 2 people is going to develop a disease. It still is a marginal input for each person, right? So if you want to do what's best, you understand that you're doing it for 10 to 20 million of you in the same demarcation. And you want to do your best. My father would be like that. My father would say, anything that lowers my risk of disease, and if you can only boil it down to a population, then I want to do what everybody's doing. His son doesn't think that way. His son wants an approach that says, I love ice cream. And if my 5.4 hemoglobin A1C is 5.5, which means 1, 2, or 3 people per 10,000 or 20,000 develop an outcome, I'm going to eat ice cream. But I'm going to do it with knowledge, and I'm going to do it with also a sense of exploration, right? So you're asking about wellness and health and using demarcations of what an individual values. Any decision we make changes, right? I would not have worn a mask 10 years ago. I'm willing to sit in a movie with my daughters. They're not wearing masks, or in a plane, they're not wearing masks, but I am. So this is a learning phase, and what matters to me as I think of my health risks at almost 70, I'm willing to consider doing things that I wouldn't, and I would think that that's a possibility for everybody. What's the decision you make now, right? The neuroscience says human beings don't know how to compare the present moment with future risk, right? It's going to be fallible. I can't predict what's going to matter to me in 10 more years, other than maybe I've retired, right? And have more time for travel and more time for engaging with my kids. So my answer to the question of how do we individualize it is to always ask the question, is that the only way you want to think about this round? Can we add some different elements to your considerations? Can we do it as a partnership? Yeah. So this is a conversation of what I think should get a Nobel Prize, which is the language of shared decision making. So I'll ask a question. Is there any choice in your clinical world, in medical practice or in life as a patient, that you don't have a part in? Right? Do your values not matter? Does your sense of risk not make a difference? How many of your practitioners make a promise? If you bring your hemoglobin A1C down, you will not develop kidney or heart or eye or neurologic disease. We know that disease happens randomly, right? So if you ask me what percentage of people with heart disease have risk factors, the answer is less than 50. The proportion of people who get ill, given risk factors, is higher, but this is life in a body. Disease happens, right? It's a random event. And so if we look at that, the question is always, what do I bring to the conversation? What matters to me? There are patients who will start with us saying, I'm not taking a medicine. I want natural care. And as we advance, and they see that things are not changing enough, and maybe they're having given it a try, they can say, all right, maybe both ways, maybe some medication, and maybe some of what I'm doing is a better path to, again, a full life, as long as it can be in relationship to values and priorities, and that we unfold it, right? And so there's always a joke. People think differently after their first heart attack. They feel differently when a friend has had a stroke. They think differently when somebody caught COVID and has post-COVID. And that's the beauty of community, right? And the limitation of, we call it the prison of the self, the prison of the right mind. It's lonely and isolating and maybe not healthy. And so if we open up at least the question, so if you're in the room with me, what you define as health becomes our goal, right? Becomes our standard. And then if the relationship holds it, maybe we start, as we move together, we learn some things together that help edify that in whatever direction it takes. I personally don't have a preference, right, in what somebody's doing, under the idea that if their values, well, here's another great thing. So somebody decided 30 years ago to have patients identify their own scale. What matters to you in your health? And what are you willing to do about it? And people making up their own scale and following it did better than people who use standard scales. They were happier and healthier. And sometimes the conversation is a false conversation. Am I going to be happy or am I going to be healthy? And we're living into a time in the nature of practice in which maybe what we're going to learn is happier can be healthier, but not necessarily. And if you're willing to explore it, you'll come up with what's your correct equation. That's the goal.